Well, the recent deaths of 6 tourists in Laos have once again brought to light the dangers of drinking tainted alcoholic drinks. Methanol poisonings are a common problem in Southeast Asia and other parts of the world. But what should you do if you believe that you or a friend have been poisoned? Dr. Chenery Lim is project manager of Médecins Sans Frontières' methanol poisoning initiative. She says symptoms of methanol poisoning often show up late, but there are measures you can take to protect yourself.
So basically for methanol poisoning, because so when you get poisoned by methanol, it is such a great imitator of different kinds of diseases. Like, for example, you're talking about diabetes, acidosis, sepsis. So the recognition of the medical staff is very, very important because the antidote for methanol poisoning is also ethanol. So you have to give ethanol to actually combat the effect of methanol poisoning. So that's why it's a little bit of, sometimes when we do teaching to medical staff, it's also sometimes they would ask us, that's the antidote, but yes, it is the antidote. So once you receive a patient and you recognize that it is methanol poisoning, you have to immediately give the antidote, and that will actually save your life.
Of course, so if someone suspects or that their friends might have been poisoned, what's the first thing they should do?
So the first thing that they should do, so usually for methanol poisoning, you have actually quite a delay in the symptoms. So it's unlike when you hang over with ethanol or alcohol intoxication or the regular alcohol, wherein you have your what you call inebriation quite a few hours. But for methanol, it's actually quite delayed. So sometimes the symptoms actually appear around 12 to 24 hours or sometimes longer. So when a patient or you experience a different kind of hangover, that you felt like you have hangover after 24 or 48 hours, you have to go immediately to the healthcare facility to be treated. That's basically what will save your life.
And how might one detect symptoms early on, as early as possible?
So diagnosis for methanol poisoning currently, especially in Southeast Asian countries, is actually not readily available. So sometimes you can detect it by using the arterial blood gas, or sometimes if you have the capacity, you do serum methanol levels. However, in majority of the Southeast Asian countries, you don't have this capacity. And that is the reason why you actually have to rely a lot on a very good history and physical examination of your patient. And this is what we really try to stress, especially in the low middle income country or low resource setting.
Yes, of course. And if one does have methanol poisoning, how soon do you think, before the symptoms and the reactions do get quite dangerous?
So basically, the dangerous part, as I said, because of the delay, it's usually between 12 to 24 hours. It's really, if you really feel very, very sick and different kind of hangover sickness that you have, because if you're a regular drinker or even if you're occasionally drinking alcohol, you will know what the typical hangover is, But with methanol poisoning, it's a different kind of hangover because you feel really, really very, very sick. You keep on vomiting, you have a very bad headache that you don't know of, you have gastric pain. So it's a very different kind of hangover that you're feeling. So between the period of 12 to 24 hours, if you feel very, very sick after a night of drinking, you have to go immediately to the healthcare facility.
And of course, prevention is better than cure. What's the best way to stop methanol poisonings from happening, particularly from the consumption side of things?
It's very, very difficult to say that you don't drink because you don't actually know if methanol is added to a regular alcohol. And that is a bit the paradox in methanol poisoning because majority of the incident that happens is like people are not actually aware. And that's the reason why when we do also awareness for preventative aspect for our organization, Médecins Sans Frontières, and the initiative is that we always teach people on what to look out for, what are the symptoms that you have to look out for, and for the healthcare practitioner also, what are the symptoms that they have to look out for the patients, because you cannot detect methanol in a regular alcohol because it's like water, when you add water in something, it's not like it's water and oil. Methanol and ethanol, they just mix like it's together, so it's like you're drinking normal alcohol because methanol is tasteless, it's odorless, so you cannot really see it. you cannot taste it in a normal regular alcohol. Sometimes we do advise that you drink beer because that's much more safer than having hard liquor.
Dr. Lim, based on your experience, why is methanol poisoning such a common problem, particularly in Southeast Asia?
Methanol poisoning is happening globally. It's happening worldwide. It's just that when you look at the event-based surveillance that we are doing, majority of the events actually happens in Southeast Asia. The reason why is that methanol is such a cheap substitute for ethanol. So majority of the time, what an alcohol producer do is they add methanol in a regular alcohol for profit reasons. And also, methanol is widely used in the industrial industry, wherein it's used in majority of the paint thinner business. Now with the shipping business, it's quite robust in the availability. So that's also why it's so easily acquired, especially in Southeast Asia, because it's being used in a lot of commercial industry. So, and that's the reason it's quite common, because number one, it's very cheap, it's readily available in the market, and usually if you're a businessman, you wanted more profit, so you add methanol in a regular alcohol to make profit. So this is really the main cause of why you have quite a lot of this events happening in Southeast Asia.
Dr. Lim, of course, your organization, MSF, has a methanol poisoning initiative. What is it? Can you tell us more about it?
What MSF is trying to do is really to tackle this issue in what we call a global problem, basically. We tackle it not just on the capacity building awareness, but we also tackle it in terms of access to diagnostic modalities and access to the antidote. What is really important for us is to make sure that the topic of methanol poisoning gets supported by a lot of health authorities, because we call methanol poisoning as a neglected disease, basically, because majority of the time you have so much stigmatization around the topic, not just for local practices, or the economic impact or the economic burden it has on a country. Because once you know how to recognize methanol poisoning, you can actually prevent people from having morbidity, the side effect of methanol poisoning. And also you can save lives of, the patients.
Okay, Dr. Chenery Lim, really good to get your expertise on this. Thank you so much.
You're welcome.